Section 5. Isolation. Step 1. Generously apply the protective lip balm SPF 30. As with all lotions, the material will absorb into the patient's tissue, providing a moisturizing, protective layer. Step 2. Instruct the patient to rest their tongue behind the tongue cup and to lightly bite down on the bite guards. Step 3. Once the retractor is in place, add lip balm to all exposed lip area. Step 4. Place the bib around the retractor flanges. Use the bib to further retract the lips by tucking them under the material. This will ensure full protection of the lips. Step 5. Isolate with the 2x2 gauze included in the Zoom 2 kit. This gauze has been tested and is proven to provide superior protection with the Zoom 2 lamp. Do not substitute your own gauze for this procedure. Open the first 2x2 gauze to a 2x4 and fold it once lengthwise. Place the gauze in the upper vestibule, tucking it under each flange. Use the end of the mirror to assist with placement. The upper lip should be completely covered. The second and third pieces of gauze will be placed in the cheeks. Fully open the second piece of gauze and by holding one corner at the midline of the lower vestibule, tuck the balance of the material into the cheek, covering all soft tissue. Do the same in the other cheek with the third piece of gauze. Use the fourth piece of gauze to cover the lower lip. Place the gauze in the lower vestibule at the fold, against the hard tissue of the gingiva. The gauze should cover the vestibule and fold out over the lower lip. An additional isolation technique. Open the first 2x2 gauze and twist. Place the twisted piece into a second 2x2 and tuck into the upper vestibule. Repeat this procedure for the lower vestibule with the third and fourth piece of gauze. The fifth and sixth piece of gauze will be placed in the cheeks. Completely open the fifth piece of gauze and fold it diagonally. Hold the corner at the middle of the lower lip and tuck into the cheek, covering all soft tissue. Repeat for the other cheek. Then place the face bib over the retractor and the gauze. Once in place, check to ensure all isolation is in place and was not dislodged. Step 6. Place the Zoom protective eyewear on the patient. Note the adjustable arms for proper fit and comfort. Remove the cap and attach the tip to the Liquidam syringe. Be sure the tip is secure and locked into place. A complete isolation requires 60% to 80% of a single syringe. Do not apply Liquidam more than 2 millimeters thick, or it may not cure completely. Step 7. Begin by applying the dam along the gauze in the upper vestibule to form a seal. Apply to the full arch, or at minimum, a single quadrant for proper coverage. Manipulating and extruding the material as you go. Make a second pass along the margin, scalloping the gingival margin to ensure full coverage. Be sure to cover all interproximal areas, sealing the Liquidam to the enamel. Step 8. Cure the application of Liquidam. Liquidam is a resin blend that can absorb heat. Therefore, use a sweeping motion when curing, moving the light back and forth across the arch for about 10 seconds. Do not leave the light in an individual area for more than 2 seconds. On the lower arch, first apply Liquidam, scalloping the teeth at the margin to allow gravity to pull the material down towards the gauze placed in the vestibule. Again, make a second pass, sealing the isolation materials. Cure the lower arch application in a sweeping motion for 10 seconds. Once complete, use the sweeping motion again on the upper arch for 5 seconds and move back to the lower arch for an additional 5 seconds. Use the tip of the syringe to press lightly on the application to ensure it is completely cured. The material should be solid and have no give. If necessary, Cure the arch again for an additional 5 seconds. Check the upper lip for any exposure. If the bib and gauze are separating, close the gap and apply Liquidam to the area. Cure the application in 2-second intervals. It will fuse the materials, preventing exposure of the upper lip. Use saliva ejection to remove any saliva pooling in the cavity. Open the final piece of gauze and place it between the teeth, over the retractor's tongue cup. Step 9. Make a final check to ensure no tissue is left uncovered. Use the motto, "No pink," as a standard. Check the interproximal areas of the application, especially on your blind side. Check the entire oral cavity to ensure all tissue is covered. Apply additional gauze or Liquidam where necessary. Section 6. Gel prep and application. Step 1. Break open the end of the swab applicator to release the solution into the tip. Apply one swab to the top arch and a second swab to the bottom arch. The solution does not need to dry. The Zoom 2 gel may be applied immediately. Step 2. To enhance shelf life of the gel, the Zoom 2 whitening syringes must be refrigerated while stored. However, the gel must be returned to room temperature for use. Either remove the gel from the refrigerator the night before, allowing the gel to remain at room temperature for at least 6 hours, or place the syringe in a cup of hot tap water for 10 minutes and remove the syringe 5 minutes prior to use. Refer to the instruction manual for specific temperatures. Step 3. Remove the cap by rotating 1/4 turn to the right. Place the mixing tip at a 1/4 angle. Rotate left to lock in place. Step 4. Do not apply Zoom 2 gel directly onto the teeth. Extrude the gel into a dampened dish or onto a mixing pad. Use the brush supplied in the kit to stir the gel and apply to the teeth. Step 5. Apply the gel to the facial area of all visible teeth, approximately 1 to 2 millimeters thick. Section 7. Begin the whitening process. Step 1. Activate the main power switch located on the side of the power supply module. The dash side of the button should be pressed for the unit to be in the on position. Step 2. Adjust the back of the chair to a comfortable position, approximately reclined 30 degrees. This is the easiest position for lamp placement, but adjust appropriately for patient comfort. Step 3. Attach the light guide to the lamp. The lamp will not turn on if the light guide is not in place. The display will read "Ready" when the light guide is attached. The light guide is designed to ensure proper distance to the light and maintain light exposure to the smile zone. Step 4. Slide the lamp into place next to the patient. Step 5. Activate the lamp by pressing the on button located on the display panel. Step 6. Slightly loosen the knobs at the end of the boom for proper adjustment. The arm should be movable but stable. Step 7. Position the lamp head to the patient's smile zone, aligning the slots on the light guide with the retractor. Step 8. Place the end of the retractor into the slots located on either side of the light guide. Step 9. Press the start button on the display panel to turn on the light and activate the timer. It will begin the 15-minute countdown. It is normal for the light to flicker for the first few seconds. Be sure to check on the patient regularly during this period. If you plan to leave the room for an extended time, provide the patient with a means to contact you, such as a small bell. It is also helpful to have a paper and pencil available in case the patient needs a means of communication. Point out to the patient that the progress of each session will be tracked by 4 lights on top of the lamp head. A light will appear for each 25% of the session. These lights are also helpful for checking on the patient's progress and time remaining. Section 8. End cycle. The lamp will beep once when 3 minutes are remaining, and again 3 times on the final 3 seconds of the cycle, with one long beep when the time reaches 0. The light will automatically turn off when the cycle is complete. Step 1. Remove the light guide from the retractor. Gently pull the lamp away from the patient while maintaining the vertical position. Step 2. Remove the gel with surgical suction and wipe the surface of the enamel clean with damp gauze. Do not irrigate. The force of the water may pull the dam loose and saturate the isolation materials. Step 3. Check the isolation materials to ensure they are intact and no pink is visible. If the patient notes sensitivity at the margin due to tissue oxidation, open the vitamin E oil and use the brush to apply the oil to the sensitive area. The vitamin E will help to soothe the tissue and act as a barrier against further gel contamination. The vitamin E oil can be applied to any tissue that has had contact with the whitening gel and may be sensitive or has turned white from the oxidation. Step 4. Apply Zoom 2 starter swabs to the top and bottom arches as before. Step 5. To ensure a fresh mix of amorphous calcium phosphate, bleed the syringe to remove the oxygenated gel. Extrude the fresh, clear gel into a dampen dish and apply as before with the enclosed brush. Step 6. Turn the lamp on and use the horizontal movement to reposition the light. Attach the light guide to the retractor and press the start button to activate the timer. Repeat these steps for a third session to complete a full 45 minutes of whitening. Section 9. Isolation removal and post-treatment. Step 1. Remove the light guide from the slots and gently pull the lamp from the patient. Slide the lamp out of the way. Step 2. Suction the gel from the teeth. Use damp gauze to remove the residual gel. Step 3. Use the cotton pliers to grasp the gauze isolation and gently pull. All of the isolation material should pull free from the mouth in one unit. The retractor should remain in place. If the gauze is excessively dry, moisten it lightly before removal. Step 4. Completely rinse the teeth and irrigate the oral cavity. If liquid dam remains interproximally, remove with floss. Step 5. Dry the facial surface of the teeth with gauze. At this time, the teeth are dehydrated and may be sensitive to air. Syringe the satin finish potassium nitrate and sodium fluoride gel directly onto the teeth and allow it to remain for 5 minutes. A complete application requires approximately half of one syringe. At 5 minutes, suction and wipe. Lightly use air to remove remaining material. Now it's time to judge the initial whitening results. With the retractor still in place, use the shade guide to determine the after shade. Document in the patient's chart and with a photograph. Finally, review the post-treatment care instructions with the patient and provide the card included in the kit for reference. Explain to the patient that the teeth are more susceptible to restaining over the next 48 hours. The teeth may continue to lighten during this period, and the patient must be careful not to consume any staining foods or beverages. It is recommended that the patient return for a 48-hour recall appointment to document the final whitening true effect of the Zoom 2 chairside system. This is also a good time to dispense the take-home trays and whitening gel for maintenance care. Additional satin finish gel can also be dispensed to the patient at this time. Section 10. Cleaning and storage. Use any standard quaternary ammonium phenolic-based disinfectant or alcohol to wipe down your Zoom 2 lamp. Do not spray disinfecting agents directly onto the unit. Do not use glutaraldehyde to clean your Zoom 2 lamp. Such materials can damage the coating surface. When the lamp is off, prior to the next Zoom 2 appointment, check the glass in the aperture to ensure no residue from the cleaning fluid remains. Position the lamp comfortably for storage in your office. Section 11. Troubleshooting. To obtain the desired whitening effect and prevent fadeback, the protocol of 3 15-minute sessions must be followed. After 2 sessions or 30 minutes of bleaching time, it is not possible to determine the effect of dehydration versus whitening. A full 45 minutes, 3 15-minute sessions is necessary for the full benefit of the Zoom 2 whitening system. The light will not turn on if the light guide is not in place. The display will continue to read, "Attach Guide." Use of the light guide is mandatory to maintain proper distance to the light and maintain positioning at the smile zone. Always cure the liquidam in a sweeping motion. If the light is held in one position too long, the material can heat up, causing discomfort to the patient. Curing in a sweeping motion allows for proper cooling of the material. Once the isolation is complete, always check the margins and interproximal coverage of the liquidam, especially on your blind side. Remember, no pink. Patients with recession are good Zoom 2 candidates, provided the exposed dentin is covered with liquidam. Once the teeth are whitened, the exposed dentin can be bonded to match the newly whitened teeth. Use the vitamin E oil to soothe any sensitive or blanched tissue from contact with the whitening gel. If the vitamin E is applied at the margin after the first session, place an additional application of oil between the second and third session to ensure the barrier remains intact. If there is a concern about excessive sensitivity, give the patient 600 milligrams of ibuprofen prior to beginning the procedure. Acetaminophen should not be used. If there is still a concern post-procedure and the take-home trays are ready, the trays can be used to deliver additional satin finish gel to the patient. The Zoom 2 whitening syringes are packaged separately from the treatment kits. To enhance shelf life when stored, refrigerate the syringes. The gel must be returned to room temperature for use or it may be runny. This can be done by either leaving the syringe out overnight prior to the appointment or placing the syringe in a cup of hot tap water for 10 minutes. Remove the syringe from the water and wait an additional 5 minutes before use. If the light does not ignite, check to make sure the lamp is plugged into the socket designated for equipment. Note the temperature of the room. If it is below 55 degrees Fahrenheit, the light ignition will be slower, with significant flicker until the light is warm. The flickering should not last more than 15 to 20 seconds. Check that the light guide is securely in place on the front of the lamp head. If the light still will not turn on, try substituting the spare light guide available in the marketing box. Warranty. Review the warranty information listed in the Zoom 2 instruction manual. Marketing. Now that you've completed this Zoom 2 training, you're ready to let existing and new patients know that they can have a brighter, whiter smile in less than an hour. For more information about marketing Zoom 2 to current and potential patients, call your media services representative at 800-422-9448.